Hello, everyone, and welcome. Welcome to another episode here on The Remedy. I am delighted to be with you once more on this beautiful Saturday. Today, I am so happy because we have someone very special who's going to enlighten us with knowledge today. So I want to take a moment, guys, to acknowledge each and every one of you for being here to begin with. Jimmy, you look like you're traveling.
Yeah, got a lot going on right now.
Well, thank you for being here. Okay. Well, thank you so much for being here. As you know, throughout the week, we've been sharing with you the topic of discussion. Today, we will be discussing substance abuse in and out of the church. I think it's important for us to talk about it because substance abuse is not something that just happened in the church or something that just happened outside of the church, but it also happens in the church. And from experience, I realized one of the things that I noticed is that in the church itself, we tend to tell people, well, we'll pray with you, or it's because you're living in sin, or God will take care of it. And all that, don't get me wrong, those are great tools. Prayer is a great tool to have when we are dealing with things, to go before the Lord in prayer. God asks us, He said, come, bring it to me, bring your burdens to me. But at some point, there are places in our life, there are situations in our lives, just as when someone is diagnosed with cancer, although the church is praying for them, we still hope that they will listen to the counsel of the doctors, right? That they will take their medication and that they will do what the doctor asks them to do. So we do understand that there's a time when we need to rely on the knowledge of the science, if I want to put it this way. So this is the reason why I believe it's important for us from the get-go to remove the stigma that is associated with substance abuse within our pews. Okay. And so before we even begin, Woody, won't you please please take a minute before we do everything else to introduce to us our guest speaker who's here with us today.
Sure, thank you. So today, knowing the importance of this topic, we felt that it would be really important for us to have an expert on the call who can talk about, who can answer our questions. And so today we have Ms. Tiffany Jenkins of Awakening Change LLC, and she has over 20 years of experience as a mental health expert, and her expertise lies in empowering and helping her clients in a collaborative effort. And so knowing that collaboration is important, piggybacking off of the science and also the Christian aspect, it seems fitting that she is our guest today. So I would like to introduce Tiffany Jenkins to the show and really thank her for the short notice and her and just when you speak to her, you realize how passionate she is and what the immense amount of knowledge that she has on this subject. So I find it fitting. And so thank you again for joining us. And we appreciate you taking time out of your Saturday. And we can get started. I think, Monty, if you want me to ask a question to start off, or if you want to, but I think what would be great is if we can talk about what substance abuse is.
Correct.
And then also talking about what are the different types of addictions that people tend to have. Mm-hmm. And then we can, go a little bit further. So Tiffany, if you want to give yourself a kind of little intro and maybe talk about your company and then talk about those two things, that would be great.
Well, first, if you can also maybe just kind of give us a definition of addiction. I think that word is used and we all think we know what addiction is. Mm-hmm. Maybe, tell us a definition of what you think or the definition of addiction is.
Okay. So first, I want to say, I really appreciate the opportunity to be here with you guys. This is a topic that I am very passionate about. In the 21 years that I've been in the field, I have to say it's very rare that I've met with pastors in particular who are willing to have this discussion. So it's really good. And I told Pastor D when we spoke yesterday, I think I'm probably more excited about being here than he is about having me, just for that reason. I want to start with saying a couple of things. One, the word addiction is one that we don't really use. It's in our field. We've tried to get away from that word because it's so highly stigmatized. So what we say is a substance use disorder. That's what most people think of when they hear the word addiction, right? Because there's a range. Substance use exists on a continuum. And I say substance use instead of drug abuse or drug addiction because it's not just drugs. Mm-hmm. So when we talk about those kind of addictive tendencies, what we're really talking about is a pattern of behavior that has existed to a level that can sometimes significantly impair our ability to live our lives. So the textbook of sorts that we use in the field is called the DSM-5. I'm sorry. Mm-hmm. It's the Diagnostic and Statistical Manual of Mental Disorders. Mm-hmm. And in there, you won't find a section that says addiction. You won't find that. You'll find substance use disorders. You'll find gambling. You'll find in the back, you'll find gaming, a gaming addiction. So the word addiction appears, but it's not a diagnosis, I'll say. Mm-hmm. There are 11 different criteria that somebody has to meet in order to, or there are 11 total criteria. Let me put it that way. If you have 2 to 3 of those conditions that are met, you're said to have a mild substance use disorder. If you have 4 to 6 of those, you're moderate. If you have over 6, it's a severe substance use disorder. And it's, again, important to say substance because this dysfunction, for lack of a better word, can exist whether we're talking about prescription medication, whether we're talking about alcohol, whether we're talking about street drugs. It doesn't matter. It's your pattern of your way of relating to the substance that becomes a problem. And those criteria range from anything as small as just taking more than you intend, all the way to developing a physical dependence on the substance where now you need medical intervention for you to stop using it. The other thing about substance use disorders, which I think a lot of people don't understand, and especially when we're talking about from the perspective of the church, because like Pastor D said, a lot of people say, just pray it away or, call for the elders of the church. That's cool. But this is a brain disease that we're talking about. Once someone has been using a substance or a behavior, because sex can be an addiction, gambling can be an addiction, gaming can be an addiction. Once you start using this thing to help you cope, your brain literally becomes dependent on the extra production of a chemical in your brain called dopamine. You literally get dependent on that rush, and it's not so hard. Yes, with prayer, it can be easier, but in some cases like alcohol, certain prescription medications, and like heroin, it's better for you to have a medical professional to help you with that detox process. So it's a lot of, there's no easy way, Pat, to answer your question. There's no easy way to define that term that we know as addiction. And what I often say when I start to introduce this conversation to people of faith is that addiction started in the garden, if you want to be technical. Okay. In the Garden of Eden, that's the best way for me to illustrate this from a biblical perspective. There was this thing in the garden, right? This tree, which had this fruit. We don't know what the fruit was. Everybody wants to say it's an apple. We don't know what the fruit was. I like apples. I don't want to damage apples in that way, right? But there was this fruit in the middle of the garden, and God told Adam and Eve, you can eat of anything else you want to, just don't touch that one because you're going to die, right? Despite knowing that, there was a craving to know what that thing was.
Exactly.
Addiction starts with craving, right? So before you can get physically hooked or even emotionally hooked on a substance, you have to start with the craving. So the Bible says that Eve saw it and that it was good. I don't know how she knew it was good because she had never eaten it before, right? But she saw it, and so she was like, I want to try this. Despite knowing that there was a very real consequence to her doing so, she went through with it anyway. And that really is the hallmark of what we're talking about when we start having conversations about this thing called addiction. It's not a moral failure. It's not that the person is weak. There is a series of events that take place. And for people in the church to say that they don't understand that is to kind of deny that you're not a sinner too. So,
Tiffany, I have another question. Can we talk about, I know that for some people, there is a direct correlation to mental illness and drug use, right? That not having, oftentimes, if you are 15 and you've gone through trauma, or 30 or whatever age, and you don't have the right tools, sometimes we kind of use whatever substance to help deal with that pain. Can we talk about the correlation between mental health and drug use or substance use?
So there's a couple pieces to what you just said. Like that's like a multifaceted question. So the one thing you said was trauma. And we have this study that was done not so long ago. I want to say about 20 years ago, but don't quote me on that date. It's called the ACEs score, the Adverse Childhood Experiences Survey. What they found was that people who had a significant number of traumas in their life, and those traumas ranged from having a disruptive home life, having parents who were incarcerated, living in poverty, not having access to the things that they need. Like there were a range of things, not just the trauma like we think of when we think of like sexual assault or physical abuse or anything like that. A lot of this had to do with like environmental factors that were experienced as trauma. Those folks were much more likely to have developed not only a substance use disorder, but also some significant medical issues and mental health issues. So you've got that one piece. Then on the other side, what you have, which is more of what I think you're alluding to, is that there is a very high co-occurrence of substance abuse and mental health issues. And part of the reason why I think that is because, especially in communities that don't have the same access to services, is because you're going to reach for whatever works. And sometimes the quickest way to get rid of the pain is, going down to the liquor store that's probably on the corner if you live in the inner city and getting a 99-cent 40-ounce can of something to drown your sorrows in. So there are these correlations, but correlation is not causation. So I'm a researcher, so we got to be really careful.
Right.
Correlation doesn't mean causation, but there is a very strong relationship that exists between mental health, trauma, and substance abuse. They seem to be kind of like, the three stooges, so to speak.
And to piggyback on what Woody mentioned, I was coming from the other side where, you have times where on the outside, it seems like that person has everything. They did not necessarily have the causation, but unfortunately, they're into that, they're going into that path. So although I do believe there is a strong correlation, we do know that's not the only thing.
It's not the only thing.
It's not the only thing, because sometimes when you look at the textbook explanation as to why somebody would go in, that person does not fit, but yet the person is still there. And I'm so happy that, at least for me, I'm learning a lot, even through the definition so far that you have said. Now, I understand there are categories, and I understand that, there's mild versus medium versus. What are some of the signs of substance abuse that we need to look out for? Because what I find myself sometimes is not understanding, is this a sign or is this just me being judgmental? So when is it a sign versus you just, since you don't drink, or I only drank one time, and if I see somebody drink 3 or 4 times, I'm at a party, automatically am I thinking, is that person, maybe having too much, where's that fine line?
So I want to back up first to the part that you said about some people who don't have those factors, right? So that's why I make the point to say correlation is not causation, because that doesn't, the trauma doesn't necessarily mean addiction. Just like, because there are some people who we know who there's still a lot of studies being done on, who have had all of this significant trauma, but they have some other factors of resiliency that keep them from going that path. Now, on the flip side of that, like you were saying, Pat, what happens is you have people who start off experimenting, but that experiment flips a switch, for lack of a better example, and then they find themselves going deeper than what they intended. And that's where we have criteria for that. One of the criteria for that diagnosis is using substances in larger amounts or for longer periods of time than you originally intended. That's usually one of the signs to lead into your other question that something is starting to go wrong, right? So I told Pastor G this yesterday, alcohol in and of itself, and we'll use that because that's like an easy one. Alcohol in and of itself is not the problem. Jesus's first miracle was turning water into wine. You cannot just say everything, if you drink, then automatically you're off to the races. But you have to balance that a little bit, right? Is what why are you drinking? Right. So that's, and some of this is deeply personal. If you're the type of person who loves going out to happy hour every Friday and hanging out with friends, and that's just the way you kind of unwind from a stressful week, I'm not going to necessarily say, you know what, you have a problem, unless you're doing things like drinking away all of, if it's payday on Friday and by Saturday morning, you don't have any money left. That might be a sign that your drinking is no longer under your control. If you are getting, you're driving under the influence, which is a huge one because you're not only putting yourself in danger, but other people as well. That's how you might know that the drinking is a little, this is not just social anymore. But again, it's going to be highly personal because what you can tolerate and what I can tolerate might be two different things. So whereas, I might be a lightweight, I might drink, a glass of wine and be like done for the rest of the night. You might be able to drink 3 glasses of wine and be okay and never drink again for, a month or two. So it's very, we have some guidelines, but it's very difficult to speak to that universally because there are so many different factors that go into it. What I would say is that you've got to have a relationship with the person that you're concerned about and just start asking them like, okay, is this a problem? Like are you, I just saw you kick back, 3 or 4 drinks. Or you start with something simple. Are you okay to drive? And just be there and be that support, because the second part of that is that what you see is going to be different. What looks like, and I'll just keep using the common word addiction because that's what everybody knows. Addiction looks different based on what you're using as well. So someone who is using alcohol, right, when they are intoxicated and when they've been doing too much, their body is going to do something a little bit different and they're going to present a little bit different than someone who might be using, we'll say, heroin, right? They're both central nervous system depressants. They slow things down, but they do that in a different way. And then the next layer of that is, how are they using the drug? Because the route of administration is going to have a big difference in how they look, what they look like, what you're looking for. So someone who's, let's say, an IV drug user, you're going to see more visibly on them that something's going on. You're going to see marks from them shooting up. You might even see skin infections that are very common with people who are IV drug users if they're not using clean work, which is the needle and the cotton and all of that stuff. If they're not using, clean supplies when they use, that's going to be a lot different. Even with, there's cocaine, powder cocaine, there's crack cocaine, there's stimulants. So there's going to be, somebody's going to be like super hyper and all that kind of stuff. But even that, there's going to be different nuances there. So it's really going to depend a lot on what is it that they're using? Mm-hmm. That's the main question. Okay.
Stephanie,
what is it that they're using?
Yeah, I was listening to you, and I remember having a conversation with a friend of mine who, and we were having a discussion about alcohol, and he's a Christian, and he said to me that for him personally, he refused to even taste alcohol, and not necessarily because of religious purpose, but because excuse me, he, as a kid, he remember watching the effect of alcohol, what that has done to his own father. And so he knows that it's in his gene, it's in his DNA to drink. Mm-hmm. And so he doesn't want to take any chances to even begin or take a chance that will open up the Pandora box. Yes. So what exactly should a person look for if you're not sure if it's in your gene? But what are some of the, I guess the question Pat asked earlier, I'm trying to ask it a different way. If you are in a family where that's something you're accustomed to, mm-hmm. but does that make you more predisposed to have some kind of later on in life, so you can become addicted later in life if you continue in that path?
So there's some research that suggests that there may be a genetic component, but we don't know how that works. So it's still up in the air. We do know that people who come from families where addiction is prevalent are more likely to be addicted, but we're trying to tease out now whether that's really just because of the environment and the behaviors that you see. Because when you're a child, whatever you kind of see in your environment becomes normalized to a degree, even if it's like really significantly dysfunctional. Mm-hmm. When you're a kid, that's your normal. So when you see that, until something different comes in and challenges that perspective, you're going to see that as normal. So we don't really know whether it's actually at the genetic level, mm-hmm. or if it's the exposure to the behavior. Think Pavlov's dogs. Pavlov trained the dogs so that when the bell went off, they knew they were going to eat, right? And so it started off this whole process where, their mouths would water and all that other kind of stuff. That is indicative of human behavior as well. So what we really don't have a definitive answer on is if it's really in your genes or if it's your environment. And right now we have more data that tells us it's in the environment than we do that it's genetic. Although there is some very promising research that they're developing, because they're actually looking at trying to find like a marker in your brain that would determine who gets addicted and who doesn't. Because like I said, everybody doesn't go from one drink or even using illicit drugs, because that's another misconception, is that you could drink and maybe not be addicted, but if you do a line of cocaine, then automatically you're addicted, and that's not it.
I have a question. I was watching something on YouTube a couple days ago, and they were talking about other countries where here in America, illegal drugs, drugs that we consider illegal, even up to what I would call hard drugs like heroin and stuff like that. And other countries, I forget which countries they are not illegal.
Probably
And
Amsterdam, the Netherlands, that area.
Yeah.
About
that
the
sounds familiar.
opiates. Okay.
I
And
Australia
she
too,
does
right?
the question I'm leading to is, what role does prohibition play into people actually going out and trying it? And I've because they're saying that in those countries they have better, um, less overdoses and less addiction problems and things like that. What role does prohibition play in people trying drugs or alcohol or anything like that?
Jimmy, that's a loaded question, and you are really trying to get me in trouble right now. But I'm going to be honest and tell you that the history of drug policy in America is racially motivated. There's an awesome book on drug policy and the history of treatment called Slaying the Dragon. I can't remember what his first name is, but I know his last name is White. And the book is called Slaying the Dragon. And he goes in detail because the policies that we have in place now, the restrictions that we have in place now, were not always the case. Most of this started around the 30s when around that same, prohibition movement, but it really goes beyond that to the late 1800s, early 1900s, when different Chinese immigrants were brought over. And as part of their culture at that time, it was normal to smoke opium, which is opiates. And it's from the same plant that we get heroin. Well, not we get, but people get heroin from, right? So there was this habit, this behavior of smoking opium. And so they had all of these Chinese workers who were pretty much like indentured servants who were working on the railroads at the time. And it was very racially motivated that these quote unquote yellow men were going to steal the white women if they and lure them into the opium dens if nothing was done about it. But they weren't saying anything about the opiates that were placed in, you hear about snake oil salesmen. They used to have these little tonics that were supposed to be good for everything. Like literally, you could give it to a teething baby. You could give it to women with quote unquote hysteria because they thought all women were crazy. So they would give them opium. You could give it to teething babies. It was good for upset stomach. It was listed as this cure-all. That wasn't touched. It was only in the methods that the Asians were using when they came over here to work on the railroad that was kind of like frowned upon. When you look at the history from there to present day, the enforcement of drug policy disproportionately affects Black and brown people. And that, I believe, is strategic because of the history of racism in this country. You also have, if you look at, let's come a little bit closer to today, back in the 80s, there was this myth about crack baby, right? And everybody heard about, crack is horrible and it's devastating the communities, which it did. But now when you look at present day heroin addiction and how the face of heroin has really been whitewashed, that now the language around it is completely different. It's about non-judgment. It's about removing stigma. It's about let's get people to treatment instead of in the 80s where it was lock them up, throw away the key, get their babies, and let's rescue them. Now, what most people don't realize is that study that was done that was so highly publicized about crack babies, it was very skewed. What they didn't tell you was that those babies were not any worse off than babies whose mothers were severely impoverished. So really poverty was the problem, but they could put another face to it to criminalize substance abuse in minority communities. So that's like a long-winded way of saying that part of the reason why we have such a problem in America is because for hundreds of years, really, we've criminalized addiction, basically racially profiled addicts as being, these horrible, no good, whatever people who are just so depraved and so horrible and something to run from and be scared of. And it's only in the last I want to say 5 to 10 years, that we've gotten away from some of that very like harsh language. Now it's someone living with a substance use disorder. Like I said, we don't even call it addiction anymore. It's a substance use disorder, because you can look more favorably if we call it a disorder, which is what we've known it has been for forever. But now you can kind of do some nice PR and clean it up now so that it appeals to folks who seem to be touched by it a little bit more. Newsflash, they've always been here. It's just harder to hide now because the overdose rates are so bad because of what it's being cut with. Other countries didn't have that drama behind their drug policy. So because they didn't have that, they now have systems where if someone does find themselves in like deep in the throes of a substance use disorder, they have resources that they can access and access freely. The other thing is, when we look at the American treatment system as a whole, like our healthcare system, compared with some of those other countries, that's the other part that always gets lost in translation when we're talking about these disparities. The access to treatment is different. The early intervention stuff is a lot different because it's not as criminalized over there. So that's like a powder keg full of stuff. But that's really why.
I think another thing is that in a lot of those other countries, a lot of those drug users tend to look alike, right? So if you're in Australia or Amsterdam or wherever, the Netherlands, majority of those people look alike. So there's a bit of empathy there because it's someone who looks like you and your neighbor. Where here it's easier to demonize because it's the other.
And here, that's true. But here's the truth about it is, we don't have that, like the when you look at just the hardcore numbers, like
right, it's the same. I know that.
Strip away the media, yeah. But we've become the face of it, right? Because if we become the face of it, then that's another reason to say, see, they don't deserve better schools, they don't deserve better neighborhoods, they don't know what to do with it. But you're absolutely correct. Yep.
Yeah.
And I think Pastor D and I had a conversation, I think 2 weeks ago, and that's another show, just exactly what you're saying in terms of how when it's something Caucasian, when it's something white, and you put the same exact thing in Black, the affirmation versus negativity is portrayed differently. And that's just another show altogether. And this is definitely a whole lot. Now, if you have someone, okay, you've identified they have problem. We've done some interventions, and I know there's different criteria, access programs. So if you are a concerned family member, if you're looking into a rehabilitation center, what are some things to look for in that rehabilitation center? Because that's another thing, the whole rehabilitative access. I know people that's been so-called rehabilitated several times, and it does not seem like anything is working. So what is it that we're not looking for, or what should we be looking for?
Well, one thing is that there is no set formula for getting it right and for being in recovery, right? So you do have some folks who can go to the best program ever, and they
relapse,
do really well.
Yeah.
And then you've got some who have that same access to that same program, and it takes them 6, 7, 8, 9, 10 times to get it together. It has more to do with the rapport that the person has with their therapeutic team.
Okay.
Across the board. I don't care if you have, and I've worked in some really low budget programs before, right? And I've also worked in boutique programs that are private pay, out of pocket. And the only difference between the two of them is how you connect with the client.
Okay.
So I would say that the most important thing is, now you have to realize that this is still a business. So if you're calling, let's say like an 800 number or something like that, you're going to get someone whose job it is to get you to get into treatment. right? Like, so let's understand that right away. But if you know that you're somebody who, if they have it too easy, is going to coast, you might not want to start calling programs that have like shore access and walks on the beach. And you know what I mean? Like that might be a distraction for you. If you are, on the other hand, like I worked for a program that had a special track specifically for executives, that they knew that their substance use was out of control, but they could not hand off what they needed to for 15, 20, 30 days to somebody else, or things would implode. So we built that time into their schedule as well. One size does not fit all when it comes to treatment. And so you really have to look at what are the things that you're looking for. Another good thing to do is research, I'll call them methods, right? So I am a cognitive behavioral therapist. So that means that for me, the people that I work with, we work on attacking their thoughts, because if we change the way they think, then we can change how they feel. And if we change how we feel, we can change what they do. There are some folks who are that have other treatment perspectives, right? So you have, like most people, when they think of therapy, they think of Freud and like laying on the couch and just talking about your childhood and all that other kind of stuff. I literally had a client who was new to treatment. She came into my office, and I have a couch, but it's not that kind of couch. She came in and she like stood at the door and she was like, wait, so I have to lay on that? And I'm like, no, you just sit down. Like, but that's part of the stigma that we have, you know, associated with treatment. One size doesn't fit all. Everybody is not going to do that. Everybody's not a lay on the couch person. I'm a little bit different as well, because I think therapy should be more conversational. So my style is a little bit different than someone who thinks that, you know, that might be a little too informal. No, we gotta ask questions. You answer the questions. I nod and I write on a piece of paper. So you have to know what works for you, and don't be afraid. This is what I really need people to understand. Don't be afraid to ask for what you need when you go into these situations. It's okay to interview them. There is no pressure, because the more research that you can do about what's going to fit for you, the better you're going to be. You know what I mean? I have a really good friend of mine is a certified hypnotherapist, right? And she does great work with folks who are okay with kind of surrendering themselves to that process and being open to it. But I have some clients that she's referred to me because they're like, I like you and all, but the idea of me not being in control, I can't get with. And so they can't get past that. It's not a bad thing. It's that just doesn't work for you. And that's okay. So the biggest thing you can do as a family member is, if you know that, you know, your loved one is not a, like a really big, like open up in a group type person, then you might want to ask, like, how many groups are going to be mandatory? Now, groups have their place. They can be very therapeutic. But if you're telling me I have to do this right from the jump, instead of let's start out with this and then we'll gradually move up to that, that might be a turnoff to me. And then when I sit there and I don't talk, then you're going to say that I'm resistant to treatment and I really don't want it. But what it is I'm really not comfortable. And especially if you're coming from a faith perspective, faith is a cultural, an area of cultural competence. You have to ask people about their spiritual and religious beliefs. For me as a therapist, I have to do that to understand the context through which they view their world.
Correct.
And that's another thing that sometimes makes treatment programs incompatible. There are some places that have gotten more progressive where, in addition to like traditional 12 steps, they'll have, there's like a Buddhist iteration, there's an atheist or agnostic iteration, and then there's a Christian iteration of the 12 steps. And they'll give folks the option for those. And then there are non-12 step recovery options as well. So it's really just about knowing what makes you comfortable, like, and not being afraid. Now, granted, recovery is not a comfortable process, right? Like you're being asked to give up the one thing that you really do cling to help you get through difficult moments. So it's not necessarily going to be a comfortable process, but you want to make sure that wherever you're going is as congruent to your beliefs and the way that you see the world as possible.
Stephanie, Tiffany, I'm sorry. I'm thinking about what you are saying, and all I can think about is a parent. Um, as a parent, I think it's imperative, it's important for you to know your child and to watch for behaviors, to watch for patterns, and to pay attention. But just from listening to you, it's also even more important to kind of know what will work or not work with your
Yes.
child.
Yep.
For example, I know for me, I have one of my children that if you were to do solution focused therapy with her, she will do great. But if you're into CBT, cognitive behavior therapy, it will be a waste of time because she's not into feelings and sharing my thoughts and all that. It doesn't work with her. Whereas another child, they want to talk about what happened to them when they were 7 or when they were 8 and why they're still lingering to what happened at 7, when you know what I mean, when they were 7. So I think you say something that is very important, that we need to really know our children as they are going through things to kind of figure it out if we are going to get them help, what kind of help that they need. And it's important to ask. I mean, I mentioned that to you yesterday. This is something that I dealt with personally in my own family. So I know the challenges that are attached to this. And it is, how do you feel, or what would you say to a parent who's contemplating whether or not they should take the next step? I'm talking about someone who's in the church. They've done the prayer. The pastor came to the house and pray with your child, and they lay hands and all that. But none of that it's not working. What would you say to a parent at this point who's contemplating whether or not taking their child to a rehab is the best thing for them at this particular time?
So 2 things I say to that. One, I always say Jesus plus therapy equals my best life. And
amen.
Because there are, the Bible tells us, be transformed by the renewing of your mind. So it's okay to pray. But if something doesn't change, nothing's going to change. So it's, first of all, take the feeling of guilt and like I've done something wrong and shame, take that out of the equation, because 98% of the time, that's what stops Christian parents from moving forward in the direction of treatment. It's, what is everybody going to think? Oh my God, my faith must not be strong enough. Something must be wrong with me. Like we get the Job's friend complex. Like, what did you do that God is so mad at you that your kid is here, right? And that's not really the case. When we can strip away all of that shame from everything, then we're really prepared to do what needs to be done. So I would say, like, get over yourself. It's not you. Like, it has nothing to do with you. And truthfully, anybody who's sitting in judgment, especially if they haven't been in your situation, they're probably not the best friend anyway. So, like, put all of that to the side. Then secondly, I would say find an Al-Anon or Nar-Anon support group. That's a support group that is specifically for family members of someone who has a substance abuse issue. And you're going to find there a community of people who will not judge you for having to make that step, which is going to then make it easier to do the next thing, which is ask your child what they think, right? Is your child ready to try that? And if they're not, then you have some hard decisions to make. Are you going to put some boundaries in place that say, okay, I love you, but you can't, let's say, be in my house when no one's home, or what, like whatever you need to do from there. But if you don't start with doing your own work and accepting the fact that this is the situation that you're dealing with, nothing else from there is going to work. And 99% of the time, 99% of the time, that's really why parents don't move forward. It's really their own shame about having this kid with this particular struggle. And that's why I usually preface these conversations by saying sin is the original addiction. And if you would not be ashamed about taking your child up to the altar for an altar call, if you still do traditional altar calls, why is there any more shame attached with getting your kid the help they need? If they told you that they were having migraines, you would immediately take them to a neurologist. If they had stomach issues, you would take them to a GI specialist. Why not take them to someone who specializes in this type of disorder? But you can lead the horse to water. You can't make them drink. So my next piece of advice for them would be to, before you spin your wheels and invest your resources on a kid who's not yet ready, talk to them and find out. Like, you can still give them literature, you can still maybe do some research, but don't do more work than they're doing. Because if you do, you might end up with a situation where they'll go into treatment to appease you, but they're not going to do anything while they're there. They have to be ready. And so that's where the Nar-Anon and Al-Anon piece is so important, because it helps support the parent while the child is in whatever process they're in.
You kind of.
I have another question, Tiffany. What can we do? And I'm sure your company, your organizations are doing that already. We know when it's time for intervention, to do the interventions, to get the rehabilitations and all of that going. But what steps can we take to prevent? Because as you know, it's such an arduous journey on every side, on the person going through it, on the therapist, on the family at home. Is there anything that we can do on the prevention side? And I'm sure there's a lot going on the prevention side. How can we prevent this, or talk more and bring more awareness, or things, or people like yourself going to the schools for 13, 14, even I'm hearing things as 9-year-old nowadays. So what can we do to bring awareness, to hopefully minimize the number of people that become substance use disorder? I'm trying to stop myself from saying addicted. I learned something today. So
it takes a while. It takes a while. I think there are a couple things in that. So we've got a ton of prevention programs, and you even said, like, in the schools they have. It used to be DARE when I was younger. Now it's like LEAD, I think, is the name of the program that they have in the schools. They have a lot of that.
Okay.
Where I think we miss it is that when statistically speaking, people of color are more likely to get information from their places of worship than they are anywhere else. Because in our communities, there is still very much a huge distrust of the establishment when it comes to medical care. We've got a history of being tested as guinea pigs, and, as early as 50 years ago. So this is not like way, back in history. So the piece that I think is missing from all of our prevention efforts is really the church. Because the church has stayed silent on this issue for so long that there are people sitting in the pews who are struggling with this, whether it's them with the actual, battling with the substance, or they're living with someone who is, or they're the parent of someone who is, or they're the child of someone who was, and they never actually used substances themselves, but they grew up in such chaos that it's really affecting the way that they interact with the world around them. And I think that we've missed such a huge opportunity in the church, demonizing substance abuse instead of, considering ourselves, right? And so one of the things that I've been really vocal about, I have a couple of partnerships with some churches. So I go in from time to time. I do workshops with actual, sometimes it's just those local church assemblies that, want somebody to come in and have discussions like these. Shows like this where folks are open and dialogue are always good. I also have a course that I taught in November of last year that, thanks to COVID, is now going to be going online, called Between the Couch and the Cross, where we talk about not just substance abuse, but we talk about trauma, we talk about mental health, we talk about mental illness, we talk about self-care, we talk about suicide. And we talk about the ways that the church has really shunned away from those topics and what we can do to kind of do a 180 and get everything and everyone back on course. So I think we need dialogues like this. This is the part that's missing. The schools have a prevention program. They get millions of dollars a year to do those prevention programs in the school. But a child that's only educated at school is an uneducated child. So if we're not following that up with what we're doing at home, if, you know, I know when I was young, I probably spent more time in church than I did anywhere else. I was Church of God in Christ. So we had, you know, we had 3 services on Sunday because you had Sunday school, you had main service, you had Sunday afternoon service, then you might have had to go somewhere else. You had Tuesday night Bible study, you had Thursday night pastoral teaching, you might have had Friday night prayer. So most of us spend more, well, before Miss Rona came to town and disrupted everything, most of us spent more time in our houses of worship than we did anywhere else. But yet, that is the place that we are least likely to hear about these topics. That's the thing that has to change.
Thank you.
I believe Jimmy had a question that he wanted to ask you, Tiffany.
Yeah. My question was, when it comes to treatment, what is the success rate versus between somebody that wants to be treated and somebody that's just being brought there to be treated?
It's like 100 and 0. I mean, you know what? Let me not say it that way. Because I firmly believe that even people who aren't ready, there are seeds that get planted every time they walk in the door. So I've had people who have been in and out of treatment. I think the highest number I've heard was a colleague of mine who spent, I want to say, the better part of like 10 years in and out of treatment, on medication assisted treatment, tried a little bit of everything. It wasn't until finally he was like, you know what, I'm tired of making the rounds in these places. I can teach these groups better than anybody else. Like, when am I going to get it together? And he did. So it's even when you're not trying to pay attention, I believe that the seeds are still being planted so that when you're ready, you can move forward into everything that, you know, that you've been learning all along. But it speeds the process up a lot more when you're there and you're willing, because I've seen just as many people who are one and done as far as treatment is concerned as I have people who, I've literally been in some programs where I've seen the same person come back 3 or 4 times in the 2 years that I worked there. So it really is highly individual, but the chances of success are so much greater when the person really wants it, because recovery is not something that I can want for you. It's not something I can give to you. It's something you have to do for yourself, because it really takes you being honest with all of the gunk that's down in there, digging that up, unpacking all of that, and really like getting to the core of who you really are. Nobody can do that for you.
I have another question, Tiffany. Now, you talked about access. Is access easily accessible, or insurance is paying for this? Are these things easily accessible?
So in the last 5 years, I would say that access has increased a lot. That has a lot to do with who's the face of addiction now, right? So there is a lot more access. There is the Mental Health and Addiction Parity Act, which requires insurances to pay for addiction at the same rate as they would mental health or other medical expenses. So most folks have some level of coverage in their insurance plans. This is including state assisted plans like Medicaid and Medicare and all of that stuff. Well, Medicare is federal, but Medicaid is usually at the state level. All of the plans have benefits for substance abuse. The difference, though, is that the better your insurance plan, the better your coverage is going to be. Yes. And what I mean by that is there's going to be, like, I have some clients who have literally a $5,000 deductible that they have to pay out of pocket before their insurance will pick up anything for them to come and see me. Then I have other clients who their all of their sessions with me are covered at 100%. They don't even have a copay. And then there are people who have varying degrees of copays and things like that. The one thing that I usually tell folks is, we're getting ready to go into a new year. If you think that you want counseling for anything, substance abuse, mental health, just general stress, anxiety, it's a good idea to sign up for one of those FSA cards if you have a high deductible. And that's something that I don't think is really promoted a lot. It sounds really confusing, but being able to kind of park away the whatever you're going to need for your deductible goes a long way, because finances are the main reason why a lot of people don't go into treatment.
And that's the reason why I'm asking.
Yeah, finances are a real barrier. And you can there are some state programs where they offer like a sliding scale or free treatment or all of that. But because that's what they do, those programs fill up quickly and they tend to have long waiting lists. So it's a catch-22. Someone else might tell you, oh yeah, it's like easily accessible. Like anybody can get into treatment. Excuse me, you can get into treatment, but can you pay to stay there? And can you pay to stay there for as long as you need? Because nobody can give you a set number and say, after this amount of days, you're going to come out and you're going to be cured and everything's going to be fine. If they tell you that, please run, do not go there, because they just want you to come in.
It's an individual thing.
Yes.
Yep. I have a question. This question is from Jimmy. He had to run. He wanted to know if there's any type of training that someone in the church can get to kind of maybe in between that point of you realize that someone needs help and before they're ready to go to a counselor. Is there like an like a triage kind of program that someone in the church can kind of take to help until that person is ready, that kind of go between that maybe a person in the church can take to help until they go and see someone like you?
So that is really going to be congregation specific. And that's part of the reason why I launched this course, because it's really for lay folks to understand kind of what your lane is versus when it's time to call in a professional, right? I think it starts with how our outreach ministries are structured and trained, and knowing. So it's about training, but it's also about self-care, right? So one thing that I'm always concerned about is in the church, we have a habit of encouraging this martyr complex where you're supposed to take on everybody else's, stuff in the name of, being a good Christian brother or sister. So we want to make sure that nobody is like going that far off and they're still taking care of themselves and staying clearly in their lane. But just doing, like I said, the course that I have will be, I think it's like a 6-hour course that goes through all of this and helps people to understand what they can do from their position. You'd be surprised. Sometimes it's just listening. Sometimes it's just being that person that's accessible when I really want to go and get drunk. I really want to go and get high. But I'm trying not to do that right now, and I need some other distraction. It's just being available in most cases, but you have to understand the nature of, substance abuse and trauma and mental health and all of that to make sure that you're putting in the appropriate boundaries.
Yeah, and Tiffany, this is from one of our viewers. Marco was asking, and I think you started answering the question. He said people normally drink to hide or run away from certain issues. So, and they use drinking as an escape, as a coping mechanism. How do you handle a person like this? And what if the issue they are having is in the church? So this is really good.
So, okay. So my first response to that is, then you got to find a new church. Like, that's literally my first reaction. That means that may not be the body for you. And it's okay. You got to figure that out. But the way that I would counsel that person is simply to let's make sure that it's really that place and that it's not you projecting something, some hurt, some trauma, something, you reading into something, because a lot of our stress comes from our own perceptions of things.
Agreed.
And if we don't like test those thoughts, we can get in a mental rocket ship and be like in the Milky Way, and everybody else is like right on the corner of the block. Like, where did you go? That was the least thing from, that on my mind. So we got to make sure. I always challenge folks. I might not be the typical therapist, but I always challenge folks. Let's look at you, because we can control you. Those other people aren't in the room right now, and you can't control those people even if they were here.
Right.
But we can control you. We can control what you think. We can control what you feel. We can control your perception of the situation. Now, did you check whatever it was that you were feeling to make sure it was accurate? Or did you just say that Brother Joe doesn't like you because he didn't speak to you last Sunday, when really Brother Joe was stressed out because one of his really good friends was sick and he was just trying to hurry up and get back home?
Mm-hmm.
Like, is it that, or is there a legit issue? And if there's a legit issue, then did you do what you had to do on your end so that when you walk away free and clear? Or is this just I'm going to have a pity party, a woe is me, and the only way that I can get out of that and feel better from that is to drink? So it's a lot to unpack with that question. Like, you really can't. I don't really deal with the other people until we've dealt with the person that's sitting in front of me.
All right, so I'm going to go back to a question that was asked earlier about the environment playing a factor in addiction.
Mm-hmm.
And I just want to mention a few words to you that are available to our young people today. Blunt, opioid, cigarette, it's illegal, pills, weed, and last but not least, vaping.
Mm-hmm.
I remember a few years back when I used to watch commercial on TV highlighting opioid, and now we have an epidemic.
Mm-hmm.
And I'm seeing a pattern again today where, a lot of our young people don't smoke, but they'll vapor.
Mm-hmm.
There are certain things they won't do, but they'll do those other things because those are more socially accepted behavior.
Mm-hmm.
What are the long-term effects of using these things that maybe we don't know yet, or no, they're not talking about those things yet because it's glamorized. There's commercials on TV. Somebody's making money out of this, obviously.
Mm-hmm.
What are some of the long-term effects of that kind of behavior as we see our young people submerging themselves into this?
Well, the broader answer to the overview thing that you got to think about with all of this is anybody who uses anything before they're 23 years old, your brain isn't fully developed. We know that between 21 and 23 is when the prefrontal cortex, which is your logic center, that's kind of the last part of your brain to develop. That's when that's fully formed. So anything that you do, especially when you're in that adolescent period where your body is still growing and developing, you're likely to damage something. And we won't know that until you get to a milestone that you don't meet. So that's the first thing, just right off the bat. Anything that you're putting into your body before it's done, it's growing and developing, is likely to have some long-term effects. Specifically with the smoking and the vaping and all of that, there's a lot of research that's coming out now about just how detrimental all of this is to your lungs. And here's the thing, whatever way you use something, it affects all of those systems. So if we're talking about smoking, right? Smoking in and of itself, let's take vaping out to the side for a minute, because vaping is a whole nother monster in and of itself. Mm-hmm. But let's just talk about smoking. Smoking has a risk of oral cancer because you have to put it in your mouth. Mm-hmm. There's cancer of the tongue, cancer of the throat, cancer of the lungs. So everywhere that travels is at risk for damage. So you start messing with that earlier. Now, the body is a wonderful thing and it will try to repair itself, but you're going to make your body work harder than it has to, right? Because you're already going to have to fight off, some of the normal progressions of aging and all of that stuff. So you're playing Russian roulette with your health. If you have a family history of any kind of cancer, now you just bump that up a little bit higher. When we start talking about vaping, there are so many different chemicals in those vaping cartridges, and there's so many different chemical reactions in that. You got the nicotine itself, you've got the flavoring for it, you've got the electronic cartridge that makes it smoke. Like, there's so many different chemicals that you're exposing your body to. And again, if you're doing this before 23, some people it's 21, but 23 to stay safe, you're damaging your body's natural ability to grow in the way that it's supposed to. And that says nothing of the emotional consequences. Because now you've started smoking as a way to maybe calm yourself down, because nicotine is very stimulating. Like it can make you jittery. So now, you go through withdrawal from the nicotine. So now you're putting your body under stress because your brain is trying to right itself from this thing that you've introduced it to and then taking it away. So there's so many levels of consequence that are involved with something as small as smoking.
I have another question. I think I want to talk about, so we're in COVID, and so people now aren't able to go out as much. They can't even go to church. How has the idea of isolation or being alone, can that trigger some people who have had an issue with substance abuse? And how can we give support to someone that we know who may have had a problem, and during this time is, like I live alone, right? I don't have a problem, but if I did, I couldn't imagine, like, I'm alone, I'm at home, there is a liquor store around the corner from my house, I can't go into a church, I can't go into a meeting. How has COVID, one, triggered some people who have had problems in the past, and two, how can we help someone during this time?
So the way that you can help is really just to be available. The phone still works. Video conference works, especially with somebody with a substance use issue or a mental health issue. Sometimes putting them on like a FaceTime or a Zoom or a video chat of some sort, you'll be able to look in their environment and see, like, usually they're really meticulous. Everything looks a mess. And that'll give you some of kind of the nonverbal cues to know what's going on with them. Most, if not all, treatment facilities have transitioned online. There are hotlines, substance abuse hotlines, mental health hotlines, suicide hotlines that are manned 24/7, literally, that have access for people. There's, let's see, we did telehealth, you got Zoom, even, what is it called? The NA and NA meetings have started going on Zoom, or they'll have chat or whatever. So there's a lot of resources. They just had to switch them online. Mm-hmm. I think it was a little bit more risky the first couple of weeks, as some providers, even I know some of my colleagues were not ready for the transition to virtual. So they had to kind of pause and regroup to get things up and running. But at this phase of COVID, I think we're pretty good with having the access to those resources all, on a virtual space. The other thing, though, is it goes back to what I said earlier. Sometimes just listening is all that person needs in that moment. So just making sure that, this is where the hospitality or outreach ministry of your church comes in really handy. Are you collecting the phone numbers or emails or whatever of all of the folks who come in, and are you checking on them regularly during this time? If there's somebody who you used to sit next to every Sunday and you used to really enjoy, turn into your neighbor and that was your neighbor. Have you called them? Have you checked on them? And this is even outside of substance abuse, because COVID is one of those situations that's affecting everybody, and it really isn't discriminating what issues you had going into it. There are people who were perfectly healthy and fine who have been struggling emotionally with a lot of the transition that's been going on. So, a call, a text can go a long way for those folks.
Tiffany, I can't thank you enough. I'm sitting here and I'm just flabbergasted by the amount of knowledge that is in that head of yours.
It's a big head. It's got a lot of space.
We are delighted. We are happy to have you, and I want to take a moment now to give you the opportunity to tell people if they want to reach out to you. I understand that you have a brand new website that you just put on. Tell us a little bit about what you're doing outside of Coming to the Remedy.
So outside of Coming to the Remedy, right now, I, as a matter of fact, yesterday just launched publicly the Between the Couch and the Cross class. It is going to be an online webinar-based format that is going to launch on August the 17th. And it is my passion, really. When I talk about this work, this is something that, like I told Pastor D on last night, when I first got into this field, I was told that, I was doing the devil's work because all they needed to do was pray about it and everything would be okay. So I've been advocating for conversations like these for quite some time. So this class is really just a culmination of a lot that I was seeing, because I've seen a lot of folks who come to me who identify, when we get to the part about, okay, well, what is your religious or spiritual orientation? They start to shy away from that because they feel as if somehow admitting that they're a Christian and they're having these struggles is a problem. Mm-hmm. So I put together a series of modules on, like I said, addiction, trauma, substance abuse, suicide even, and we're going to unpack that. So the course itself is self-study. And then what we'll do is we'll have a series of conversations like this over Zoom, where we'll kind of dig a little bit deeper and, explore some of this stuff in a little bit more depth. And what I would like to do is offer any of the viewers of the show who want to take that course. If you enter the code PDVIP, you're going to get $50 off of your registration.
Oh, we're VIP now. That's what's up.
Yes, you are VIP now. So the course is going to be $125, but for your viewing audience, it will be $75 after that discount.
Awesome.
Now, I have a question, Tiffany.
Yes, ma'am.
Back into the course. Now, this area is also an area that is very frowned upon by the IRB, which is the Institutional Review Board, which pretty much the goal of the IRB is to, they look after human beings. So I do clinical research, and when we're doing studies, you have to have IRB approvals just to make sure that the people are not being used as guinea pig.
Right.
So someone that take your course that's in a church, like Jimmy, and I want to use that as a way to better help himself assist the parishioners. Mm-hmm. I know specifically in the US, they really frown upon people not having the proper credentials to help people. So where is that balance so one does not get him or herself in trouble?
So here's the thing. This isn't a credentialing course. This is an informational course. And it's good that you bring that up. I'm in IRB right now. I'm working on my doctorate. Hopefully it'll be done next year. So I am very clear throughout the entire class The folks who took it live with me will tell you that we spent like a whole 20 minutes on do not try this at home. So I'm very clear that this is not a training class. Now, if you are a licensed minister in most states, and you have to check your state for the specific regulations, but if you are a licensed minister in most states, pastoral counseling is within your wheelhouse.
Agreed.
You are licensed to do that if you are a licensed minister. Now, each denomination has their own criteria for their the levels of ministry and whatnot. But in most states, if you are especially if you're a pastor or a licensed minister, that falls under your ministerial duties. What you cannot do, unless you have a license, is diagnose or treat a mental health or substance abuse issue. Awesome. I happen to have a substance abuse license and a mental health license. And I also am a certified supervisor for developing clinicians. So yeah, I'm real clear on this. I'm not telling you to go out and do this. The purpose of this is more to build understanding, to decrease stigma, and start stimulating these conversations so that at least people are getting correct information.
Perfect. Thank you.
Thank you.
Here I thought we were closing, but there's one question. I hate not, because we have people watching us on YouTube and on Facebook and so forth, and sometimes we tend to forget about them. There is a question from someone on YouTube. She was asking, is there a difference between vaping, nicotine, and MJ? Now I don't know what MJ
marijuana.
Yeah, I don't know
marijuana
what it is either. What is MJ?
Marijuana.
Oh,
marijuana. Yeah.
Okay. Right. That's ganja, huh?
Yeah.
Patty, don't show your age.
Well, no, if she had said reefer, then that would have been a whole nother. So yes, there is. Okay. So if you're talking about vaping can have nicotine, and some of it does not have nicotine. So that's vaping. It's a cartridge that's got some kind of liquid in it. It's usually kind of like battery operated. That battery is usually rechargeable. That creates the steam so that you get the illusion of smoking. There is some they have some vape cartridges that do have nicotine, and they've tested it, and the nicotine in those is higher than in an actual cigarette, which is what makes it more addictive. And then when we're talking about marijuana, you can get marijuana in an oil to vape, but marijuana and vaping aren't necessarily the same thing. Mm-hmm. Marijuana is a plant that is technically a hallucinogenic, that it has a number of implications. The oil of it has a number of implications, but it's the THC in it that gets you high. So recently there's been a lot of discussion around marijuana versus cannabis oil or CBD oil. Mm-hmm. CBD oil takes the THC out of it so that you're getting the medicinal properties only and none of the psychoactive effects.
Yeah.
Okay. Thank you so much. So now we come to the end of the show. Wendy, hold
on. There's another question from Wendy on the screen.
Oh, yes. Thank you. Thank you for that. Wendy was asking, what are some ways to try to help the adolescents steer clear from substance abuse?
Give them coping skills, because all substance abuse is, for most adolescents, is coping. For other adolescents, it becomes recreational. But if they have enough other ways, healthy ways to spend their time and expend their energy, they have healthy outlets, they have supports, they have people that they know they can talk to without any judgment or consequence, they're not likely. And that there's ton of research to back that up, that they are less likely. That becomes protective factors. They're less likely to go to substances.
Mm-hmm. Mm-hmm.
I remember when my kids were adolescents, and the goal was to keep them busy, put them in a lot of sports, keep them so busy that they don't really have time to think, because they go from school to just all kind of activities.
Well, not that busy, because that busy actually creates some level of anxiety and overachieving and all that other kind of stuff. You want them to have a healthy balance. Mm-hmm. You do want them to be so active that they're getting the dopamine naturally, because when you're physically active, you release dopamine, right? And that's all the drugs do anyway, is give you dopamine. So if you can keep them physically active, they're going to be on a natural high. But you also want to give them balance so that they learn at an early age what self-care and balance look like, so that they'll be well adjusted in the future.
Got it.
The final question of the day. What are your thoughts on medical MJ?
And also, can you, to add to that, microdosing?
I'm sorry?
And also microdosing. What are your thoughts on medical or medicinal MJ, and also microdosing?
I'm sorry, Woody, I can hear. And also what?
Microdosing.
Okay.
So I don't think I've heard of microdosing before.
I don't know what that is either.
It's probably something that refers to, I'm going to double check real quick while I'm answering the first part. Medicinal marijuana is an interesting, I'll call it conundrum, because you don't really need the marijuana, all of the marijuana, for the effects that you get. Whenever you light something on fire and put it into your body, you cause another set of chemical reactions. So if you can get, the benefit without having to introduce this new stressor, I'm all for that. So I regularly talk to my clients about CBD oil, CBD gummies, like all of those type of products that are really going to give you the same kind of long-term effect. It's really good for anxiety, really good for pain, all of that kind of stuff. I do have clients who have, because New Jersey has a medical marijuana card. The problem with making a blanket statement about that is that I've also seen people who have that card because they are problematic abusers of marijuana, and this is now just a legal way for them to use it without any kind of consequence. Now, that doesn't make it all bad, because there are some folks who would prefer to smoke it rather than taking a pill or the drops. They have the oil where you can put the drops under your tongue. It's a matter of preference. So I'm not totally against it. I just like it better, because like the CBD oils and pills and gummies a little bit better, because there's a little bit less risk. Microdosing. So that's a really,
I know it's a touchy topic.
It's really bad.
Can we talk about what microdosing is first? Okay. I don't know what it is.
So microdosing is where psychedelic drugs like LSD, ketamine, things like that are used in small doses to help treat mental health or mental illnesses. And it's there have been some studies that I've seen on treatment-resistant depression that have used some of these more LSD type drugs. I think it's a slippery slope, because human chemistry is so fickle. Your body chemistry is different than mine. And what might be a small dose for you might be a large dose for me. And knowing what I know about medicine in this country, I'm not a fan. Now, with that being said, you also have to understand that there are a number of cultures who use psychedelic drugs as part of their religious rituals and things like that. And they've got a different take on it and a different stance on it. So that's one that I don't think I want to touch. Like, there's too many layers to that to really. I haven't seen anybody that I've worked with where I thought that would be a necessary treatment. I'll put it that way. But there is research. It works for some folks. It doesn't work for others. But because of like what's considered a micro dose, because it's saying 1/10 of a dose, but that 1/10 of a dose might be too much for one person, not enough. So I think that's still kind of subjective. And because I'm not on the chemistry side of it, I'll just say that I've never seen anybody that I thought absolutely needed it. Everybody that I've worked with has been fine with either vitamin supplements, changes in activity, maybe CBD, or what's the other one, theanine or something like that, like one of those like multivitamin type things. But I've never met with anybody in my the folks that I deal with, and it might be because primarily most of my career has been spent primarily with addictions or co-occurring, so I'm less likely to see that.
Right. Okay. That
All
makes
right.
sense.
Thank you. Well, once again, Tiffany, I just want to take a moment to say thank you on behalf of the crew.
Thank you.
It was such a delightful pleasure to have you on the show today. We have learned a lot. And I always say this, at the end of the day, if all we did was to challenge you to think a little bit, or to have a conversation with your kids or with your significant other, we have done the job. I want to challenge those of you who are leaders of the church to take this, to really take this seriously, because this is, I truly believe this, because we and Stephanie, Tiffany, you mentioned it earlier as well, because we kept silent and we haven't dealt with it for so long, it's becoming more and more a problem that we cannot deal with. And so it is imperative for me personally, it is important for us to remove the stigma that is associated with it, to not to, we always want to put a demon over substance abuse. We will pray it out of you. But in reality, there's so much more going on in the mind. And I always say we can rely on science, because God is the one who gives us the brain power to understand science and understand the human body. So I want to challenge everyone who's watching to have that conversation. It's not going to be an easy one, but it's a much needed conversation. Have it with your children, have it with your spouse, have it with your church leaders. Call them and say, hey, what are you doing about this? I know so and so, she's always, she comes to church, but I can smell the alcohol in her breath. She always have a little bottle in her pocket, or brother so and so is always in the back pretending to be doing something else. So we know the signs, we know who they are, we know what's happening, we know when our kids are not being themselves. So we need to make sure that we allow them to know that we are here for them. I think that's the key too. Let them know that we are here for them, not to make them feel ashamed because they're already dealing with something to begin with, but to help them to understand that we are here for them. And if they take that first step, we'll take the other 99 steps with them. So with this, Tiffany, once again, the doors are always open. I want to
thank you so much, guys. It's been a pleasure.
Special thanks to Woody and Pat and Jimmy, who had to leave a little bit earlier today. It was an awesome show. You are always welcome.
Yes.
Whenever you want to come back to the show, just give us a call. Say, hey, I'm thinking about this. What do you think? Let's make it happen. The doors are open. And once again, can you tell people how to get in touch with you, if besides your email, if they wanted to get on your website and so forth?
Okay, so my website is www.awakeningchange.org. If you want to stay in touch with me and be up to date on everything, there is a sign up for a mailing list. And every time something new comes out or something happens, you can go there. And I am on Facebook as Awakening Change LLC. I'm also on Instagram as Awakening Change, and on Twitter as @Awake Counseling.
Awesome. Well, you heard it first here on The Remedy. Guys, thank you so much. Be safe out there. God bless you. Can I
thank you
with you before we go? Father God, we just want to say thank you. It was an amazing show. Thank you for your power. Thank you for your Holy Spirit. Thank you for allowing your children to go to school and get the knowledge so that they can come back and help your church. We love you. We appreciate you for all that you are doing in our lives. Father God, please continue to help us to lift each other up, to help one another in our time of needs. We appreciate you. We love you. In Jesus' name we do pray. Amen.
Amen.
Amen. God bless you, family. Have a wonderful week.
911.
I need an ambulance. My son's not breathing.
What's the address? 10731.
Yes, hurry.
Is he blue?
Oh, God, he's dead.